These are the diagnostic sights and sounds of the human heart, and a wondrous component within the heart known as the mitral valve. This small valve is essential to the heart's normal function, for the mitral valve controls the blood flow from the heart's left atrium to its left ventricle, which then passes oxygenated blood into the heart's aorta, the body's superhighway of sorts. And this particular mitral valve belongs to this particular man, Neil Forney, age 61, of Sammamish, Washington.
Interest and hobbies, well, attempt to play golf. Kind of into restoring old cars. I guess affectionately known back in the 60s for street rods, so I've got one of those. Went to school here at the University of Washington, and then went to work for Caterpillar, and they've moved us quite a few different places. Lived in the Midwest, lived in Eastern Canada, spent 13 years in Southeast Asia, several different places there, Singapore, Manila, Hong Kong, Kuala Lumpur, and Malaysia.
This is a story of how Neil Forney came to know the UW-Medicine Eastside Specialty Center in Bellevue and its diversity of world-class services on a very intimate basis. And it starts, coincidentally, with the UW-Medicine link in the jungles of Malaysia outside of Kuala Lumpur.
The university had something to do with the help of the startup or the design of the particular hospital in Malaysia. I remember they had a great big plaque in the front foyer giving credit to the University of Washington for the design and the support of that hospital. And the doctor that I was assigned was a cardiologist, a Malaysian, and had done his studies in the UK. And he was first to kind of hear, basically said, well, you got a kind of a funny little click in your heart. But, you know, keep your eye on it, and there's nothing to worry about, but just be aware of it. So, geez, that was about 10, 11 years ago, I guess.
A decade later, Neil was back home and had an appointment at the UW-Medicine Issaquah clinic with his new physician, Dr. Trish Martin.
Hi, Ann. How are you? When I examined Neil at that initial visit, the most impressive thing was a very loud murmur. Not only was it loud, but it radiated up into the neck and into his left armpit. And that's a murmur that needs to be looked into. That type of murmur is very suggestive of a valve problem.
Neil's echocardiogram showed something unusual.
I had Neil and his wife come in, and we went over all the findings, and I told him, you need to see the cardiologist. You may need to have heart surgery.
Hi, Missy. Do you have the lab results from this morning?
Neil's doctor referred him to Dr. Fendley Stewart at the UW-Medicine Eastside Specialty Center.
The mitral valve is very important because when the left ventricle or the main pump of the heart contracts, you want that blood to go across the aortic valve into the whole body. The mitral valve has to close so the blood doesn't go backwards into the left atrium toward the lungs where the blood originally came from. So with the mitral valve leaks, blood then is going the wrong direction into the left atrium, and that can lead to a number of problems. From my point of view, having read his echocardiogram, knowing that he had severe mitral regurgitation, my initial focus was to determine whether or not he had any symptoms of the mitral valve disease, and he really did not. He described good exercise tolerance, he didn't describe any significant arrhythmias, he had no heart failure, so he was asymptomatic. And so it's very interesting is that we have a patient with severe mitral regurgitation who also doesn't have symptoms. Well, we discussed his options, which would be early repair or close follow-up for the development of symptoms or heart muscle dysfunction. And Neil made the decision to go ahead and proceed with early repair.
I thought, well, geez, this is great. At least, you know, I'm not having a heart attack, so this is great. Let's fix it. I'm a great believer in fix before failure.
I referred Neil to see Dr. Aldea at the University of Washington Medical Center, where he'd have a chance to talk to a cardiothoracic surgeon, in this case Dr. Aldea, about the operation, any risks of the operation.
I met Neil for the first time in the outpatient clinic where I see new patients, and you can imagine this is a time where he and his wife are highly anxious. Going to see a cardiac surgeon is not something that somebody's looking forward to, and we are very appreciative of this.
The thing I liked about it was one of those hurried things where you've got, he's got 5 minutes to talk to you and he's off to the next patient. He spent all the time that we required and sat down and talked the whole thing with us, and really gave us the reassurance.
We understand what a privilege it is to do what we do. And so my job and what I try to do with patients is to share with them not only what the specific issues are, but my enthusiasm for what I do, and to give them a really good, realistic plan of why we do it, how we do it, and what he will feel like.
At the end of the day, my wife and I both said we walked away very confident that we knew what the problem was and what the repair process was going to be, and pretty good odds of how it was going to turn out.
Neil had a very leaky mitral valve, which is the valve that sits between the upper and lower chambers of the left heart, which led to a situation of progressive congestion of his lungs, and in addition to it, he had a heart blockage. The mitral valve is a parachute-like valve that allows essentially the blood to flow in a single direction in the heart and to allow the heart, as it's beating, to maintain effectiveness.
Okay, let me see the aortic cannulation cannula.
The surgery that we performed here requires making an incision and exposing the mitral valve itself, which sits inside the heart itself. What we're able to do is to determine what portion of the bottom portion of the mitral valve, the posterior leaflet, was abnormal, remove that segment of it, reconstruct the structure of the parachute, and then brace the whole repair with what's called a ring annuloplasty to take the tension of the repair so we maximize the long-term outcomes.
We're looking for peripheral flow that looks good.
In addition to it, because this patient had a blockage in the coronary vessels, and this is something that we do routinely since we know we're going in to fix the valve, we were able to, at the same sitting, bypass the coronary blockage to prevent problems from occurring later on.
Good news is when I got out of surgery, I discovered that they were able to repair the valve. So you know, the doctor at times says, well, you get the 2-for-1 deal. So I got one bypass and I got a valve repaired.
Good afternoon, Eastside Specialty Center.
Eastside Specialty Center is actually quite unique in the country. There are very few academic medical centers that have multi-specialty clinics. So we have orthopedics surgery, and that's general surgery and vascular surgery, gastroenterology, cardiology, and in each of those services we have several individuals with sub-services. We also have a variety of ancillary services, the vascular lab, an echo lab, physical therapy, x-ray, clinical lab.
Can you tell me what brings you to the vascular lab today? At the vascular lab, we do ultrasounds of the cerebral vascular arteries. The arteries go into the brain. The arteries in the legs, in the toes, in the fingers, in the arms, and the arteries in the abdomen from the heart to the aorta. We also look at all the veins in all those places, the veins in the legs to rule out blood clots, the veins in the arms to rule out blood clots for people that might have pulmonary embolisms, which is potentially fatal. Turn your head to the left for me. This patient that I'm seeing today, she has been complaining of dizziness, and I'm going to do a carotid Doppler exam to see if there's any plaque in the carotid arteries that could have potentially caused a stroke, which in effect would cause her dizziness if she did have a stroke. The equipment I am using is an ATL HDI 5000 ultrasound machine. The ATL HDI 5000 has the ability to monitor blood flow and the speed of the blood in the arteries. And one of the things that I do specifically is if the speed of the blood is going faster in a specific area, that to me means that it's narrowed. And I give a degree of narrowing in the arteries for the doctor so they can go in and fix that spot.
Dr. Michael Sobel's practice is focused exclusively on the treatment and diagnosis of problems in the veins, specifically varicose veins.
Of all the centers I've worked at in my career, I think the Eastside Specialty Center is one of the best places I've ever worked. What really makes it unique is the staff who work here.
How do you do?
Hi.
Welcome to our clinic here.
The attitude of our staff, from professionals like our ultrasound technologists and nurses, right through to our secretaries and assistants. Everyone has this great can-do attitude.
There have been several incidents in the vascular lab that have impacted me personally. Just the other day I had a lady come in and she had a cold foot. She'd never been diagnosed with any vascular problems before, and I took one look at her and saw that she had a blockage in the artery going to her leg, and did her lower extremity arterial exam and found that she had a complete blockage in the flow to her foot. She went over to the university, to the ER, and had an arteriogram and angioplasty, and they were able to save her foot.
What I enjoy most about being a doctor is the opportunity to make patients better. In particular, in my specialty, I get great rewards from the improvements that patients experience with our treatments. And to come to clinic and to see a patient who says, gosh, my leg feels so much better, I should have done this years ago, is just very rewarding, and it keeps me going in this business.
So let's start with what I call the prayer stretch. Okay. So go ahead and come over here and get on your hands and your knees.
Brenda McKenzie is a physical therapist.
And with this one, what you're going to do is you're going to keep your hands in this position, your knees stay in this position, and you're going to move from your neck all the way down to your lower spine, as much as you can tolerate. I help people with pain that they may be having, and that kind of ties in with movement dysfunctions that may have been causing pain, and work on different exercises, work on manual therapy skills to encourage movement or to help them learn to stabilize certain areas. So go ahead and put your feet on the ball. My most enjoyable part of my work is seeing how patients are able to recover and that they're able to get back to their activities that they want to do. There you go. There was one particular gentleman that I worked with that had a lot of back pain. He had been in a car accident and had some paralysis in part of his body, and he just wasn't able to play with his kids anymore. We worked with him for several weeks on a pretty detailed program to help strengthen him and to help him walk a little bit more evenly and be able to do transfers, getting on and off the floor so he could get on the floor with his kids and play with them. And he was just a new man after he left. He was very excited. Go ahead and relax. To have someone that is willing to participate and work so hard makes you want to work harder to help them, and then to have such, to have such a gratitude from him and his family is irreplaceable.
I'm heading over to the Eastside Specialty Center. I have an appointment today with Dr. Stewart, and also they're going to take a follow-up echocardiogram of me today. The Eastside Specialty Center, one of the real advantages of it, it's close. It's probably 10-15 minute drive from here in Sammamish over there. And parking, you can park right at the door. So I mean, that's those two for nothing else. It certainly makes it a great advantage. Hi.
Hi there. How are you doing?
Neil Forney. I have an appointment with Dr. Stewart. The staff at the Eastside Specialty Center is quite phenomenal in the fact that they remember your name, and I think I've only been over there 4 or 5 times, and so when you walk in and say I have an appointment, that's it. Oh yes, you don't have to go through all the insurance rigmarole or anything. It's just, hi, how are you? The doctor will be out in just a few minutes. It's that kind of hominess that you really appreciate.
My name's Ren. How are you doing?
Glad to meet you.
I'll go ahead and take you back in for your test.
Okay.
Let's go. You've had this done before, right?
Yes, I have.
All right.
We moved up here from California a little over 2 years ago, and we had some experiences with the University of California medical system. They weren't the best, weren't as particularly friendly. It was more mechanical, hurry up, take a number, you're just another person in line.
Do you need a blanket, or are you comfortable?
Oh, it's fine right now.
Okay, ready to get started?
Ready. And we really impressed not only with Dr. Stewart, but the whole system of being very, very approachable, giving you the amount of time that you need.
It's right there, and that's where the repair is done.
Echocardiogram is a lab that supports our cardiologists primarily. So if a patient has a heart murmur, they need to do an ultrasound of the heart So we have that available right here in our cardiology area where they can meet with a sonographer.
So far, it's measuring all pretty normal again. So.
He or she does the monitoring. And again, our doctors who are here read those studies so they know, they can tell the patient right away and interpret them right away.
Hello, Mr. Nimitz.
Better.
How you doing? Good. So, back for another set of injections?
Yep.
Okay.
Orthopedics and sports medicine are available at the Eastside Specialty Center. Everything from hand, wrist, ankle, knee, and shoulder repairs to complete hip and knee replacements.
Is your pain most with weight bearing?
Just weight bearing.
Okay. How about when I do that or that?
No.
So you have some fluid in there again, huh? So I'm going to mark you up like I always do, okay? And like we talked about before, it doesn't matter where your pain's at. The knee joint's like a big balloon, and we have to hit that balloon. That's the easiest spot to do it from the outside there, okay?
Orthopedics at the East Side is quite varied, and we also have 2 sports medicine physicians, and that sort of dovetails into orthopedics.
You're going to feel a little pinch.
The idea here is that patients can be cared for on the East Side. So if a patient has, let's say, they need a gallbladder surgery from one of our general surgeons, they would come here for the lab test, they would come here for the preoperative exam, they would have the surgery at the Surgery Pavilion in Seattle. They would come back here for all their postoperative checks. So they would only have to go to Seattle once, really, for the surgery itself.
Hi, Dr. Stewart, looks like he ordered a cholesterol test for you today.
The Eastside Specialty Center has a clinical lab as well, which provides patients the opportunity to have their lab work done while they are in to see their healthcare providers. The lab also assists when working with patients who have anticoagulation therapy.
Looks good. I'm going to have you put some pressure on this cotton ball here. Great.
I'll just let you have a seat right there. And I just need you to lay your hand flat up here for me. Great, just like that.
Kathy Marcos is an imaging technologist.
A lot of people don't realize that they're mostly digital x-rays now. They're not like they used to be. They come up instantly on the screen. We print them out instantly. The doctors have access to them online and instantly on the screens.
The immediacy of these digital images is quite remarkable.
All right. Okay, that's it. We're all finished.
Only 3 seconds after x-rays are taken, they are available online throughout the entire UW Medicine system. Digital plate readers provide clear images which can then be electronically transmitted, while hard copies can still be printed off for traditional viewing and analysis.
We had one patient, a 20-year-old male, had congenital hip dysplasias on both sides. Very difficult for him to walk, and in the 3 years that we've been seeing him now, he walks just like anybody would. I mean, it's amazing how well he walks now. And for somebody that age, that's significant.
Mr. Perry?
General surgeons are at the Eastside Specialty Center twice a week.
You enjoying the sun?
Not yet.
Not yet. Same here.
And when we're here, we see a combination of people who are thinking about having operations or people who've recovered from operations. We also see a group of people who need small operations that are performed right here.
I'm sitting right on the table.
We often take care of patients with extreme obesity who are here considering bariatric surgery, surgical procedures to treat that obesity. And I can work together with orthopedic surgeons and cardiologists and other types of doctors to really deliver the best care so that when the person does have bariatric surgery, it's delivered in the safest fashion. Another example, we have gastroenterologists here who can help diagnose problems that occur in the colon, cancers or other masses that need to be removed. Hi there. Hi, I'm Dave Flum. Surgeons here do all types of operations. We remove small intestines when necessary, the large intestine for cancers or polyps that are too large to be removed with a scope. We take care of the problems with the stomach. The gallbladder and hernias are also common things we operate on. Okay. So if we removed some of these, could you take, if I did it on a Friday, would you be working that weekend? Or no. You could take a couple of days off. Sure. I try to take care of every patient as if they're a family member. I recently had the opportunity to go with my dad to see a doctor. And I was amazed that that's not necessarily the way people get treated by doctors. It was embarrassing to me to see the way that my dad got treated. And I vowed a long time ago to make sure that everybody who I take care of them as if they were my brother or sister or a loved one.
Neil Forney had that experience, both as a heart patient and during a previous hernia repair treatment performed by Dr. Flum.
Very approachable, gave you a lot of time, explained what he was going to do, the reasons that he did it, just made you feel like he was truly interested in you as a patient.
I love solving problems and helping people with problems that they have. As a surgeon, you really have an opportunity to help people when they have a crisis or when they have something that is really bothering them. The interaction is very fulfilling because we have the tools to deal with the problem.
So here's your original study here, and it shows the mitral valve prolapse. You can see that leaflet go way back here when the mitral valve closes. So that's, I would say, severe prolapse of part of the posterior leaflet. Neil has done really well. He has not had recurrent arrhythmias. He has resumed normal activity, and his exercise tolerance is normal for him, as it was before surgery. So let's contrast a little bit now this very abnormal mitral valve before surgery with prolapse of the posterior leaflet with the valve now. And the valve looks different because it's been surgically repaired. And so now what we see is some brightness here in the valve. This is the site of the repair, so the posterior leaflet was actually partially resected and brought together. And then a ring was placed around the mitral valve to make the mitral annulus smaller. But that allows the mitral valve now to close properly. The echocardiogram today documents no residual mitral regurgitation after valve repair, and his heart muscle function is still normal.
How often do I need to go back and check it and just make sure that everything is still operational?
Neil's prognosis should be excellent. His repair result was so good that I would hope that result would be very durable, lasting as long as Neil does, and hopefully that's a long time. I don't expect him to have problems with the mitral valve in the future, although we will monitor him carefully to make sure that he doesn't develop mitral regurgitation in the future. I plan to see him in clinic once a year and examine him, and if any murmurs develop or problems, we can repeat an echocardiogram to reassess the mitral valve.
Kind of as appreciation for all you've done for me. Here's a little memento of the company I work for. It's a kind of a tension reliever, so use it in good health, okay?
Well, thank you very much.
Enjoy it. Thank you. And appreciate everything you've done for me.
Oh, you're welcome.
One thing I liked about Dr. Stewart was the fact that he was very approachable, and he did an excellent job of explaining.
Joe, is our treadmill patient ready?
Yeah.
I enjoy working with the staff here. I know a lot of patients on the east side that I follow this is very convenient for them to see me here. Interestingly, I also have patients who come to see me here from Seattle because they like coming to see me here because it's very easy for them.
Do you feel like you have any congestion down in your chest?
No, not really.
The Eastside Specialty Center is beneficial not only because of its location, it's easy access to all the communities on the east side, but the specialists who actually come there. They're not only top-notch as doctors, but they're easily accessible for docs like me, the primary doc, who's sending the patient in. Okay, so then I just want you to look kind of straight ahead for me. Finley Stewart, the cardiologist who saw Neil Forney, he let me know right away by telephoning me and letting me know this echo is very abnormal and we need to do something about this soon. And I love that collegiality. That's how it's supposed to happen.
I have a very close relationship to the Eastside Specialty Clinic. Typically we would get a call, a personal call from Dr. Martin or Dr. Stewart to say, I have a patient, we're sending this patient to see you. I've done some tests that on this particular patient, and I believe this is a diagnosis, and I would like them to see you in person. In addition to it, the Eastside Specialty Clinic is virtually and by hard cable connected to the University of Washington. So I can see their records, they can see mine, I can see the actual physical tests done, such as echocardiograms, electrocardiograms, and things like this. And so they're truly part of the University of Washington. This personal relationship between myself, my colleagues, and a patient, both here and in the community, and the seamless interaction is very, very special.
And this is a little bit of joint disease in a patient who has lost some of their space because of obesity. The Eastside Specialty Center is a little bit of a jewel in the University of Washington crown. It's a place where you can get great care, be seen by all the docs you need to be seen by, and get in and out in a very efficient and timely fashion.
The benefits as we experience it is the whole system, where you go from the primary care system like the one that we use in Issaquah, and any referrals that they move us into the Eastside Specialty Clinic, and from there then they move you on to the main hospital if required. So you've got the access to all of that specialties, but yet you've got the closeness and the friendliness of the clinics, and that's what we really appreciate.